Hi, how to measure relation revise करवाओ. So there are three relationships that we record: orientation, vertical, and horizontal. So first relation that we record is always the orientation relation that is recorded by face bow. That gives us the relationship of illa with the base of the cranium or the skull. Face bow, it is arbitrary type and kinematic or hinge type. Arbitrary type, it has earpiece type and fascia type. Okay. Now methods for recording vertical jaw relation. Two types of vertical relations, that is at rest and at occlusion. Firstly, we have to record at rest relation so that we can record the at occlusion dimension. So at rest, we have two methods to record: facial measurement method and the anatomic landmark method. In facial measurement, we measure from the nose to the chin by a divider or scale. We have some measures like Willis gauge or Dacometer. And second method is the Willis guide, that is we measure the distance from the corner of the eye or the pupil to the corner of mouth is equal to the distance between the anterior nasal spine to the lower border of mandible. Now at occlusion, there are two methods to measure the vertical dimension at occlusion. First is physiologic and mechanical. Physiologic method, we have Niswonger's method, that is VDO equal to VDR minus freeway space. Freeway space is 2 to 4 mm. Then we have swallowing threshold, phonetics, that is Silverman's closest speaking space while we speak the letter S. Then neuromuscular perception and aesthetics. Some mechanical methods are ridge relationship, in which we look at the incisive papilla relation and the ridge parallelism. Some pre-extraction records that we can refer to, that is profile photo, profile silhouette, radiographs, articulated cast before extraction, facial measurements, and the previous or former dentures. Now horizontal relation are of two types: centric relation and eccentric relation. Eccentric, we have protrusive and lateral. So centric relation we measure, record by three various methods: static, functional, and graphical. So in static method, there is wax rim method, in which we heat the wax and position most retruded position of mandible by heat, by pinning the rims, or by nick and notch method. Then we have some interocclusal check records. Functional method, also known as chew-in method, Needlehouse, Patterson, and Mayer. In graphical method, we have Gothic arch tracing and pantomographic tracing. Now the eccentric movements have protrusive records and lateral record. Protrusive record can be measured with these functional and graphical methods. And for lateral records, there is a formula that Hanau gave, that lateral condylar inclination is equal to h by 8 plus 12. That is horizontal condylar inclination by 8 plus 12.